Again, welcome to everybody. And as you can see from the title slide that I'm Sandra Carter and Diane C. is co-presenting with me today. Today's webinar is about keeping you informed about the updated standards of practice, which will come into effect on June 1st. We intend to provide an overview of key changes within the standards. But first, before we start that, we'll like to get some housekeeping items out of the way. The webinar is being recorded and will be posted on our website, social media platforms, and our YouTube channel for you to access and view at a later date. All participants are muted today to minimize any disruptions for the attendees. We have over 600 attendees joining us today. And so if you have questions as we go along, please feel free to use the chat box, and we will be reviewing and collating all the questions with the plan to publish them as a Q&A following the webinar. At the end of this webinar, you'll be able to vote for future webinars that will focus on specific standards. So let's get started. Next slide, please. Let's start off with our land acknowledgement. We recognize that we work and live on traditional lands and territories of Indigenous peoples. This includes the traditional territories of the Mississauga, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Wendat peoples. Today, the province of Ontario is home to many diverse First Nations, Inuit, and Métis peoples. From the Cree in the northern reaches to the Delaware in the south. We acknowledge that we are tasked with sharing, respecting, and valuing the land as a source of life for us all. Next slide, please. During today's webinar, we will be discussing what are the standards of practice, why we updated the standards of practice, what has stayed the same, what's new, key changes to specific standards, and the application of the standards. The intent is not to provide a line-by-line comparison, as we wouldn't be able to cover everything in 1 hour. A few may have sent questions ahead of time, but we encourage you, if you have specific practice situations and would like to talk about the updated standards, please feel free to contact Diane or I, and we will be happy to walk through the standards with you and the application to your specific and unique situation. Next slide, please. So what are the standards of practice? Well, they outline the minimum expectations of performance. And what does that mean? They're accepted by the profession as agreed upon performance expected of an OT, regardless of the practice area or setting. Essentially, the standards are the musts, or the rules explaining what behaviors must be demonstrated to provide evidence that the standard has been met. Of course, the standards will describe safe, competent, and ethical practice. And you've heard these terms before. And all occupational therapists, whether you're clinical or non-clinical, are responsible for knowing and understanding and applying the standards to their practice. Next slide, please. So why did we update the standards? Well, partially in response to the need for public protection. Recipients of OT services were asking for greater clarity on what to expect when receiving services from OTs. There's recognition that as time evolves, so does the practice of occupational therapy. And with that comes the need to modernize the standards. And modernizing the standards was an opportunity to improve the user's ability of the standards, to reorganize the content, update the language, and incorporate the new competencies of practice that were launched in 2021. By using a principle-based approach, the standards are flexible enough to apply to all areas of occupational therapy. So now I'll turn it over to Diane.
Thank you, Sandra. Despite all the new changes, we do want to start by reassuring you that there are aspects of the standards that have stayed the same. The main one being the purpose of the standards. Its purpose and an OT's professional accountability to meet these standards have remained the same. The standards continue to describe the minimum expectations for performance in all OT practice. And just like before, if a standard didn't apply or you needed to deviate from a standard, you would be expected to provide a rationale. So a simple example would be if you do not perform acupuncture as part of your practice, the standard for acupuncture would not apply in your situation. Next slide, please. So what's new? We won't be going through all the line-by-line changes, as Sandra mentioned, but we will highlight some of the more significant high-level changes, both in the overall document and in some of the specific standards. First, you may have noticed there's an overall new look. Some of the standards have had their titles changed slightly or were combined together. For example, you can see here on the slide that the old standards for assessment got a new title to reflect that it now includes intervention as well. Throughout the document, standard statements were removed and replaced with headings in keeping with the use of plain language. So again, using the example of the standard for assessment and intervention, you can see that beside number 1 is a heading that says, screen the requests for services. The performance indicators then follow after the heading. The standards are now all in one document with a general introduction at the beginning and a glossary at the end. We have removed repetition and reduced the page count from 240 to a much more user-friendly 50 pages. Next slide, please. The one document comprises of 10 standards, with each standard outlined in this format. It will first start with an introduction to the main topic and explain why the standard is important. It is then followed by headings and sets of performance indicators or specific behaviors that show how the standard is to be met. Lastly, there is a list of references related to that standard, which includes college resources, as well as legislative and regulatory documents. Next slide, please. What's also new is the language. The updated standards are now written in plain language in order to reduce the jargon and improve its clarity to registrants, the public, and others. It also incorporates language from the culture, equity, and justice domain of the new competencies. For example, the term stakeholders was replaced throughout the document with the term interested parties. There is now also a glossary to help readers with unfamiliar terms. Next slide. And of course, the content has been updated. The main updates include integrating the new competencies, as well as the expectations on the new domain of culture, equity, and justice. Standards have been elevated to principle-based statements, so essentially they are less prescriptive. This allows more flexibility for OTs to apply and meet the standards, especially in emerging and evolving practice areas. This also meant removing clinical examples that were specific to practice areas, as the goal is to have a set of standards that apply to all OTs. Instead, specific practice examples will now be moved into other college resources and documents in order to support OTs. You will find these in the form of guidance documents, case studies, and Q&As on the CODA website. I'm going to hand things back to Sandra.
Thanks, Diane. So many of you may wonder, do the standards apply to non-clinical OTs? The answer is yes. The competencies of practice expanded the definition of client and includes communities, organizations, etc. And the term service is used throughout the standards to encompass all aspects of occupational therapy, including non-clinical activities such as leading education sessions, coordination of services, researching, or teaching. As a non-clinical OT, the standards will fit into your specific practice. For example, you will have record-keeping responsibilities along with managing information. So as the standards outline, you will have to keep that information secure and confidential, understand potential conflicts of interest, and manage expectations and monitor professional boundaries with the individuals you interact with in the context of your role, and also recognizing any power dynamics. And this is just a few. Next slide, please. So we're heading towards getting into the specific standards. So the standards with the least updates, acupuncture. There were minor changes. We changed the terminology from electrostimulation to electroacupuncture. We clarified some of the language around training and competence, infection prevention and control. There's a new indicator for OTs to conduct a point of care risk assessment, and that may mean different things in different practices. What the intent is here is to ensure that you're looking at the risks for your practice and attempting to mitigate them. And use of title. We added a reference to the psychotherapist title. We added a new indicator, the protected OT title in a position of prominence. And what that really is asking is that when a client comes in contact with an occupational therapist, that it's clear to them and easily identifiable that this individual is an occupational therapist. Another new indicator is to ensure students from other professions under the OT's supervision present their student title clearly and transparently. And we removed the standard on misuse of title. Next slide, please. Standards with the most updates, assessment and intervention. And Diane will get a little bit more into that standard. Consent, prevention and management of conflicts of interest, psychotherapy, record keeping, and we combined a few standards to reduce some of the redundancies and repetition. Professional boundaries and the prevention of sexual abuse have been combined, and the supervision of students and occupational therapy assistants have been combined. Next slide, please. Now over to Diane.
Thank you, Sandra. We will now go through some of the key changes to each of these specific standards, starting first with the standard for assessment and intervention. As already mentioned, the title is new. The standard now reflects expectations for not only occupational therapy assessment, but also for intervention, with new performance indicators around developing and implementing the occupational therapy plan. The standard has also been updated to align with the competencies, specifically the culture, equity, and justice domain. So there are now additional expectations to co-create an assessment process with clients that is culturally safer and accessible, as well to carefully consider the social, ecological, and economic implications of care, and to consider culture, equity, and justice principles throughout the occupational therapy assessment and intervention process. Next slide, please. Moving on to the standard for consent. This standard has been updated to provide more clarity on the two forms of consent, informed and knowledgeable, and the expectation for OTs to know and obtain both. It also clarifies the information and OT responsibilities around third-party consent. The standard now clarifies that OTs need to know and apply the privacy legislation that is applicable to their practice area. It recognizes that PHIPAA, or the Personal Health Information Protection Act, is not the only privacy legislation that OTs may be working under. So it's important for OTs to know whatever the privacy legislation is in their practice setting, and therefore in the standard, specific references to PHIPAA have been removed. Next slide, please. The revisions in the standard for the prevention and management of conflicts of interest were mainly to provide clarity. The definition of conflict of interest is now more concise. It also makes clear that client consent is not an acceptable reason to practice while in a conflict of interest. More context is now provided around the expectations for gift giving or receiving, self-referrals, and incentives. Lastly, conflict of interest considerations for research or quality improvement projects have also been included, illustrating again that these principles apply to OTs in clinical and non-clinical activities. And now I'm going to pass it on to Sandra to continue with the other standards.
The standards for psychotherapy. This is one of the standards that underwent significant changes. And we understand that those who are practicing in this area will want to perhaps take a deeper dive when looking at this standard. So what's new? The standard applies whether you are practicing psychotherapy or the controlled act of psychotherapy. One of the major changes was around the supervision requirements. Now, we had included a panel of psychotherapists or OTs practicing in psychotherapy to assist with looking at what is appropriate given the practice area. And this standard now outlines that the supervisor must be qualified to provide supervision and registered with one of the 5 authorized colleges to the controlled act of psychotherapy. It also clarifies the type of supervision that is acceptable, either one-to-one or small groups. It also clarifies the period of formal psychotherapy supervision and defines the quantity and quality of the supervision required, which has now been changed to 50 hours of supervision over 2 years. And there is flexibility because we recognize that not everyone is performing psychotherapy full-time. The standard also now clarifies the supervisory document. So there are expectations around the supervision agreement and determining when it is acceptable to move to a more consultative arrangement. There's also clarification around the 3 components of psychotherapy training. So we have instructional, which intended to be instructor-led, not self-taught. Theoretical, so it's based on psychotherapeutic theories, and practical, which involves the supervision. Also, there is a performance indicator that, should it be necessary, that verifiable documentation will be available to the college upon request. And so I know that that may be one of those performance indicators that everyone may focus on, but should it be necessary? And it's like any other OT practice, to provide your decision-making or your rationale or evidence how you meet the standards. We've also included a performance indicator that an OT should never participate in supervisory arrangements solely for billing purposes. Financial records should clearly identify who provided the direct services to the clients. And as well, we intend to have accompanying resources, which will be available, as Diane mentioned, in the approach of guidance documents, Q&As, case studies. What is and has been updated is Appendix 2. And it's intended to be a resource to help OTs determine when the standards of psychotherapy applies and when they do not. So what falls within the mental health realm. Next slide, please. The standards for record keeping. Although we have listed this as one of the standards that underwent significant change, many of the indicators or the content of the indicators still remain in this updated standards. So what's new, as we've already talked about, the inclusion of the competencies of practice and how these two align, is to be sensitive about the wording of notes, that you are document relevant clinical information around group therapy. So there's some clarity on what the expectations are for those of you who are practicing within groups. We have an indicator to review and document that you have reviewed the occupational therapy assistance documentation, if they are required to document. And again, when co-signing records completed by students, to ensure that the documentation is complete and accurate, and that a signature is appropriately affixed. And also, we've included in these updated standards how to manage privacy breaches, the expectations around that. And as Diane noted earlier, we have moved away from referencing only PHIPAA, or the Personal Health Information Protection Act. However, OTs who are health information custodians and are governed by PHIPAA are responsible for managing the client's records and should have a contingency plan for unexpected events that may occur to their practice, which would enable clients to remain having access to their records. Next slide, please. The standards for professional boundaries and the prevention of sexual abuse. So the obvious change is the title. They've now been combined. We've elevated the definition of what is an appropriate therapeutic relationship. So you will see performance indicators that state clearly and concretely, never form intimate, personal, or romantic relationships with current clients. As we know that those relationships can exploit the power imbalance inherent in the client-therapist relationships, and would the OT maintain that objectivity? So we're very clear. There's no avoid, prevent, it's never, okay? There is greater clarity on the power dynamics between the OT and the client, and clearly stating that OTs should minimize the personal information sharing with clients. So that's also been elevated. And also in terms of the prevention of sexual abuse, we know, and it still remains, that consent is never a defense. And so we expect OTs to know and follow other mandatory reporting requirements for sexual abuse. This standard also clarifies when an individual no longer is considered a client, and it aligns with the current legislation. Next slide, please. The standards for supervision of students and occupational therapy assistants. What's new is the title change. Again, we combine both into one based on the overlap of the expectations around supervision. The other important change was a change in title for OTAs. They are, in these standards, referred to as occupational therapy assistants. And part of that reasoning or rationale was around the legislative expectations for protected title, and considering what does the public see first. However, the standards do acknowledge that other titles are used. It doesn't mean that the job titles need to change. It's just in these standards, we have reflected and are following the legislation. The core expectations for supervision are elevated and pushed up front. And we've divided the performance indicators for students and occupational therapy assistants. The supervision of students are now into two sections, or have two headings. The performance indicators around traditional supervisory placements and non-traditional or role emerging placements. We've also updated and clarified accountability for non-occupational therapy assistants. Next slide, please. And so I will turn it over to Diane.
Thank you. So we have just completed a high-level overview of some of the key updates for the standards of practice. And you're probably wondering now, what's next? Well, first, we encourage you to review the new standards of practice. There is much more detail and information that we simply can't get into today over a webinar. Fortunately, the document is only 50 pages now, so it should be a much easier read. And after reviewing it, go back and reflect on your current practices. Hopefully, you'll see that there's already some alignment to the new standards, because in principle, a lot of the content has remained the same. But you may notice or identify any gaps or learning needs or changes that needs to be incorporated. As we already mentioned, we did make some content updates, and really a lot of it was to align with the new competencies. So go back, take a look and reflect and see where any changes or learning needs need to be incorporated. Next slide, please. If there are additional standards, if there are individual standards that you would like us to discuss more in depth, please let us know, as we plan to have additional webinars that will focus on specific standards. You can let us know now via the Zoom poll, which should appear on your screen now. There it is. So it will stay on your screen for the next few minutes. All you have to do is select the standards you want to know more about and submit them to us. For those who are not viewing this webinar live, you can still email your suggestions to us on which standards you would like to see featured in future webinars. We will share the results of the poll in a few moments. As I give you a few more seconds to cast your votes, we will move on to the next slide. Next slide, please. There we go. So as you continue to cast your votes, I also want to invite you to send your questions about the standards of practice to us. You can do so by entering your questions into the chat box now or by sending us an email afterwards. We thank those who have already sent in questions ahead of today. Due to time limitations, we're not able to answer all the questions during the webinar, but we will take all the questions we receive, collate them, and post the responses at a later date as an additional resource. Sandra and I are also available to discuss your specific practice situation on an individual basis. So please feel free to reach out to us by phone or email, and we'd be happy to have a discussion. So as we wrap up, I'm going to end the poll now. Again, feel free to send us an email afterwards or give us a call if you have suggestions that come to mind after the webinar.
And thanks, Diane. Many of you may have questions, additional questions, and we will read everyone and we will provide a response. I know there was a lot of information presented today, and there may be new terms, questions about how to apply the standards, and we will be publishing additional resources. And so we want you to stay tuned for that. June 1st is coming up, so we want you as registrants to get familiar with the standards. Some of you may have taken a look, some of you will just open up the updated standards of practice. We are available, so do not feel that any question is out of bounds. That's what we are here for, to help you understand and apply the standards, the upcoming updated standards of practice to your specific practice area and setting.
And as we go to our last slide, please. You can stay connected with Kodo through our newsletter and various social media outlets. Stay tuned for announcements of future webinars. They will be announced on all these different platforms. And that brings us to the end of the webinar. Thank you for joining us today.